Misha.
Hi, everybody. Hope you're all doing well today. So since it's just me today, we're going to take pace a little slower. I hope you have a lot of questions. I have a couple of topics prepared. Let's start with statistics. It looks like we have broken the peak. In the last week, there has been a decline in COVID cases and hospitalizations slightly by about 10-15%, depending on which state you're looking at. That's all good. I actually do hope that indeed we're going to start getting through this, because it looked in the past couple of weeks, it looked like there were a lot of people getting sick. Other than that, no changes to variants, same ongoing issues. And so the main topic for today, which I want to bring up, is I'm trying to figure out where my internet window here went. So I need to copy paste something. So big news is the study that just came out a couple of days ago, and I'm going to give you a link to the Medscape article. Medscape is one of the many medical news. There's several large networks. This is one of them. There's MedPage, there are a few others, and I kind of just often screen through all of them. This topic came up today, so what I'm going to do is, why is this not working? So the study that just came out, basically beginning to give a strong hint as to what's going on with long COVID brain impact. We used to think that the effect was multifactorial. The idea was maybe it's simply related to more of a mitochondrial dysfunction. Turns out that it at least in this study that I'm about to copy paste as soon as I figure out how this works. Okay, there we go. Turns out that it's basically a trauma. It's a significant trauma, and you can literally think of it as a post-traumatic disorder, in essence, in terms of the way the imaging shows and the way this article positions. So basically, you get kind of a brain injury, if you will, and then the recovery looks as if it's a post-traumatic injury recovery. Okay, so this is the link to the article. You can go ahead and take a look at this. So with that in mind, what I was thinking to cover today was to really talk in quite depth about brain health, and particularly what do you do as a recovery from brain injury. So this is going to be a broader conversation. It includes not only the COVID, but it also includes post-stroke recovery. It includes recovering from literal physical trauma to the head, whether you had a fall and then concussion, or you had some other brain injury. I just give you some ideas what those injuries could look like. You could have chemical injury when it's some kind of an acute toxic effect. You can have a post-infectious effect, whether it's a sepsis that significantly caused brain dysfunction, or any other, or specific brain infection. And so there's a whole categories of something we describe as meningitis, or inflammation of meninge, which often causes delirium and possible consequent slow recovery with a cognitive impairment. What's kind of shocking and scary is basically, according to the study, most of the patients who evolve this long COVID / post-COVID cognitive impairment, it kind of equals to losing 20 years of age in terms of brain aging. You're kind of gaining 20 years of aging instantaneously over a period of just a couple of days or a couple of weeks during the COVID itself. And so they're kind of saying the effect is so dramatic that it's way more dramatic than any other post-infectious syndromes, with just few exceptions. They haven't really discussed the details of comparing this, but the importance here is, imagine if you, in one whoop, lose 20 years of brain cognitive function. I mean, that's a lot. Now, can you recover it I think we don't have enough evidence to yet to see sort of what's going to reverse this effectively. So now, of course, they don't give any suggestions of what to do about it. The typical recommendations for something like a stroke recovery would be you do a lot of therapy, and that therapy includes speech therapy and also include what sometimes described as a cognitive therapy, which are ways to try to mitigate some of the dysfunctions. You can think of it as a brain physical therapy, if you will. Of course, it's quite effective, and that's the mainstay treatment. However, as we know, there's lots of other things that can be done. So one thing I was going to show you, I'm going to put up a slide deck for a second. I'm not going to talk about all of the slides here, and we already discussed some of this. When we talked about Recode, the kind of Alzheimer's treatment. So there's a lot of correlations and a lot of things that can be cross-utilized. So let me put main screen sharing on. Okay. Middle. So this is like, in a way, what you can think about is this way of thinking. So you have a lifestyle interventions that would be sitting on top. So this is the diet, and then exercise and mind-body work. Well, lots of different types of diets would work just fine for brain recovery. You don't have to go ketogenic. Some people do suggest that, or there have been some studies done showing that possibly ketogenic diet enhances recovery quickly. Problem is, ketogenic diet is, has potentially very significant limitations long term. So if you're gonna try to do it, it should be something between 3 to 6 months period. Beyond that, there is an evidence of microbiome disturbances, and probably nobody should be doing this, with some exceptions. If you decide to do it, you should probably talk to your provider. But doing Mediterranean or MIND or KetoFlex diets would be quite a good idea. We've talked a lot about it. I don't want to spend too much time except to say that you want to make sure that whatever the choice of diet you pursue, that you do periodic intermittent fasting. That appears to be, for the brain recovery, a big deal. Idea goes along the lines of, brain does like to operate on ketones, on fat, on alternative sources rather than on sugar periodically. You don't have to be in it constantly, but that would be important to be in part of it. Interestingly, for exercises, we think that yoga tai chi would be just as effective as any other type of exercise, whether it's weights or endurance or aerobic. It's probably all about the total amount of exercise, and also the fact that some of these exercises are probably, in my opinion, should all be gearing towards mind body. That's why I'm kind of saying yoga and tai chi are a perfect mix, because it's both. The physical activity that is rather well documented. Remember, I have presented some weeks ago talking about specifically Tai Chi for brain health, right? If you have not seen that video, I will make sure that I'll get a copy of it to Janet, and you can take a look at the podcast I did with Elizabeth Armstrong, who's the head of geriatrics in OSU and in Oregon, and she presented a whole talk on effectiveness of Tai Chi for cognitive impairment. But of course, the second big deal is the cognitive exercises and games. And I'm actually going to discuss this separately in a couple of minutes. We're going to talk about some of the options here. And we're also going to talk about, as a part of that, a light therapy and sound therapy. I'm going to cover all of that today. So then there's this tremendously long list of supplements. Now, this is not an inclusive list. It is very complicated to talk about anything specific. I'm not going to mention anything. It's in front of your eyes. I would say that you probably don't want to randomly experiment and just pop things. It may be better to have someone guide it. If you're going to take something and you don't have a capacity to go and see a provider, I would do only two things. And the reason I would do that is because those two things, in my opinion, have the most evidence, and they also have the highest safety profile, and it's going to be difficult to overdose it. So first, I would take a very high quality B vitamins complex that has methyl B12 and methyl folate both. It has to be this. Well, methyl B12 is not as essential, but it has to be methyl folate. There's lots of different brands that are quite good, but it has to be what's sometimes described as nutraceutical brand rather than direct-to-consumer. Direct-to-consumer brands are still carry folic acid and cyanocobalamin, synthetic forms of B12 or folate and B12. I recommend that you try to get organic forms, or they're not just organic, they're really more biologically active forms. So that's one, so B complex. The other one is fish oil or omega-3, and I like to use the 2-to-1 ratio of DHA to EPA. Particular product I like is the Protocol brand, and it's DHA 500. And you can take 2 to 4 a day depending on your personal needs. So those two would be very safe to say. Everything else on this list is a lot more complicated. I'm not going to go there. Why there's so many things listed? Well, if you think about this, when you have a brain injury, it doesn't matter what kind, you're going to have to repair. And the repair will require not only the cellular blocks, so the blocks to build the cells themselves, but more importantly, what blocks do you need to bring the new connections between neurons? And that requires a lot of support to cellular membranes. Cellular membranes, basically this sheet of cells that sits all around the cell. The critical aspect of any cell membrane is the liquidity. The cells should be very easy at letting through chemical signals. If it can't do that, if for whatever reason some receptors on the surface cannot transmit the signal very well, the cell membranes become kind of slow and stuck, gunky. That happens sometimes when the particular nutrients are missing. And there's a whole list of them. Like, for example, I'm going to mention choline. Choline is a really important precursor to acetylcholine, which is basically the signaling molecule that transmits the signals between the cells. So if your diet is low in choline, supplementing with CDP or alpha GPC, CDP choline or alpha GPC is wise. And actually for patients who already have cognitive impairments, we quite often do this. We give them this particular form. Why? Well, because again, you want to boost the amount of choline present. By the way, the first approved anti-Alzheimer's drug is actually an inhibitor of the breakdown molecule of acetylcholine. So, even drugs are targeting the same path. So that's a very big top. Now, we're not going to talk about the rest of it here because, addressing drivers in each particular case is beyond today. But what I do want to mention is it's not uncommon for people after brain trauma to start manifesting new issues. So I often see when patients come to see me after concussion or with long COVID, we start doing workup and the patient will say something along the lines, well, before all this happened, I haven't had any problems. And now all of this is sort of not working great. So we start doing this workup of all these drivers and we find all kinds of things. And people ask, well, but I didn't have a problem before. Well, yeah, so your problem was there, but it was still hidden. So it wasn't obvious to you. You didn't have symptoms that have led to a full manifestation of ongoing struggle. And then the acute trigger is basically manifested everything else. So in a way, then you should ask, but okay, but if I resolve my current brain trauma, shouldn't all these problems go away? And then who cares if I have a mercury sitting there from my teeth? Well, it's just easier said than done. Often that non-recovery, so you get the cognition gets worse, and then this brain trauma becomes prolonged and you don't recover fast. And you don't recover fast because those things are there. So in essence, you could ignore it, but you really can't, because the recovery depends on a normal activity of all kinds of extra mechanisms that when you're normally operating, you don't necessarily need. So I mentioned some of these extra nutrients as a simple example, because you may need a lot less choline if you're not trying to rebuild, some percent of the brain cells because you lost them due to whatever the insult, not just COVID. It can be anything, it could be stroke, for example. Okay, so I'm going to pause here for a second. Take a look what questions, take a look on the time. We're doing well. All right, let's see if we have questions. I'm going to pause because then I want to cover the cognitive gaming, light and sound therapy as a separate conversation. Okay, would a 14-hour overnight fast be sufficient? Yeah, I think plenty is sufficient. The thinking is that maybe even 12 hours will be sufficient. The problem is in 12 hours, you're just starting to generate ketones, so it may just not be enough. But yeah, so the belief is that somewhere around 14 to 16-hour mark is more than enough every night to generate a little bit of ketones to give the brain this break from burning sugar, okay? So it's not necessarily that the brain, in essence, our body doesn't care what the energy source is, right? So for the energy production, whether we burn sugar, fat, or carbs, the endpoint is the same. We make NAD or FAD, molecules that carry the electrons. But it's the way the fuel is burned, so to speak. So the carbs tend to burn more smoky, even though that's counterintuitive, right? Usually you burn paper, it burns clean, and fat burns with the smoke. The body does the opposite. So if you get confused about that, reverse it. But that's seems to be the case. The thinking is then, well, why not to be in a fat burning state all the time? Well, because it does cause some really long-term metabolic shifts that potentially not necessarily beneficial. So ketogenic diets have to be applied for only few specific medical problems. Brain cancers could be one, and certain types of seizures could be another one, just as an example. But they're not necessarily all that healthy in the long run, even though for short periods of time, entering ketosis seems to be the answer to this issue. It's probably enough not to live in ketosis all the time, just sometime. So, all right. Aside from the brain fog, what would be the symptomatic for long COVID brain effect? Well, so, post-brain injury, regardless of the cause, the fog is only one thing. You basically can have picture that it looks anywhere from a full-blown memory loss, like a mild Alzheimer-like condition, which we actually quite often see in patients with long COVID, to something very specific. For example, you could have intact memory but horrible concentration. Why it happens this way, I think that there's a lot more research needs to be done. It's not very clear why some patients would get kind of lack of concentration and lack of capacity to maintain the concentration. And some people will have much more memory problem, but their concentration is going to be okay. You'd think that the same condition would cause something more specific. I think that has to do with more of an individual impact and also individual brain development. Some people have certain parts of their cognitive operations structured better, and so those particular neuronal pathways are going to just be stronger. So they're going to be more resilient to stress and damage, versus others may not be. So it's an easy example. Let's say you had an attention deficit disorder that was well managed with medication, and then you get a COVID, and it's not unusual for us to see a person just being completely falling apart, ADHD getting way worse right after COVID. So that's a good example, because there was already a weakness in that pathway, and now it's sort of exacerbated, in contrast to somebody else who may have a completely different. Okay, so since we're talking about this, I'm going to do another short deviation, just in line with the news. I'm sure you've seen the articles all over the news about nose peaking leading to Alzheimer's disease, right? And you probably have a gazillion of questions. What is that? And do I pick a nose? And if I do pick a nose once a day, am I going to develop Alzheimer's disease, or what's the... Okay, so first of all, don't worry. It requires a lot of nose peaking for many decades in order for this to sort of correlate. Second of all, it appears like basically we already known quite well that the dental infections can increase risk of cognitive impairment. Turns out that any infection in this area that is chronic, that is recurrent, is a potential issue. So when you're doing something with your nose inside, there's a higher likelihood you're going to bring infections from the fingers, from dirt from under the fingers, or simply there is a bacteria sitting in the nose and you're just disturbing the superficial layer, and so it goes a little bit deeper. And believe it or not, researchers find the pieces of dead bacteria inside the plaques in the brain of patients with Alzheimer's disease. So we know that somehow the blood-brain barrier that is thought to be impenetrable for infections is not as impenetrable as we used to believe. We used to think that it's a pretty good layer to screen out all the garbage from the brain. Turns out that it has its own problems, and at times it fails, and then this basically post-infectious or current infectious particles somehow end up in the brain, and they find not just bacteria, they find viral pieces. In fact, quite clear that there's a strong association of chronic viral infections with a higher risk of Alzheimer's disease. Again, that includes varicella zoster and herpes 1 and 2. So, correlation there. So I think it does fit in today's topic because of all this news. Seems to be like there's a lot of cognitive news all the time lately, which is, I find it very good. I find it that finally we're taking this whole subject very serious, and there's a lot of effort goes into research. Okay, so how often does one have to intermittently fast in order to? Well, that's a great question. So I think if you're doing 12 or 14 hours nighttime, I would say this is something that should just be a routine, that you should fast probably most days of the week, so maybe 5 or 6. You probably would want to do it in a very consistent way. So it's probably not useful to fast for a couple of days, take 2 weeks off, and then fast again. If you're fasting for shorter periods of time, you need to do it a lot more frequent. Some people say, well, what about fasting, say, 24 hours once a week? Yeah, that could be also a reasonable approach. The problem with that approach, it's actually much harder. The easiest thing would be to simply think of it this way. What is 14 hours? 14 hours is you stop eating at 7 and your first caloric intake is at 9 a.m. the next day. Most of us should have absolutely no problems doing it. And most of us, even if you say go to sleep a little bit later and you like to have your dinner later, okay, fine. So have your dinner end at 8, go to sleep at, say, 11, and then have your first meal at 10, right? So, or even a little bit further. And try to do it. And the first thing is to see how you feel. People often, when they start shifting, there's a period when you don't feel really well for a while. So it takes a while before you can find a new equilibrium. Good question. Okay, so how to keep the nose clean? Well, great question. Neti pot, big fan. So you guys familiar with what I'm talking about? Put that in the link, and I'll talk about that for a minute. We covered that at some point. So Neti pot is a traditional Ayurvedic method. Just like brushing of your teeth, you're supposed to clean your nostrils and back of your mouth. So you mix a cup of water with a teaspoon of salt. Preferably the water should be filtered or distilled. I don't think you want to put tap water up your nose. There could be some risk if the tap water is contaminated with some bacteria. You don't want to do that. We just talked about it, right? You don't want to introduce new infectious elements into your body if you can avoid it. So please do use filtered water. And then you literally pour the water in one nose and it comes out of the other nostril. That means that everything is flowing, that the nose is well connected, communication is good, both nostrils are open. You can have, it takes a little bit of getting used to. There are plenty of YouTube videos how to do it. I keep meaning to make a video, but I'm realizing that's the one that I need someone to make it for me. It's not easy to set up the camera, talk in a camera while you're doing this. So You'll have to forgive me. I'll have to figure out how to shoot this sooner or later. Or maybe I'll find a good yoga practitioner. Maybe I'll ask Yael or Jennifer to help me with that. I think that would be actually a good thing to do. Okay. So yeah, neti pot would be my first choice. People always say, well, what if I have a frequent nasal infections? Okay, there are two possible scenarios here. You could be colonized with a chronic nasal infection. It could be staphylococcal infection, it could be streptococcal infections. There's a variety of different infections. There's several species of streptococcal infections which are associated with an Alzheimer's disease. It's been, again, established. And also, there's certain types of infections, streptococcal infections. If you still have it there, your body's capacity to detoxify is going to be shot. It has to do with the biological signaling, hormonal signaling that sort of suppresses production of some of the detox molecules. So for that reason, sometimes we would actually give a spray. So we would give a spray with antimicrobial. Sometimes that spray will also include biofilm busters, so something like EDTA, because often infection sits protected by a layer. In certain areas of our body, the infection can cause biofilm. So biofilm is this layer of sugar on top of the bacterial colony that protects it against any kind of external insult, including having antibiotic put on it topically. So that's sometimes, topical cream antibiotic may not work because you're going to need to first burst the biofilm before you can apply antibiotics. That's why, sometimes we order compounded nasal spray that includes EDTA. You use neti pot at the same time you brush your teeth, morning and night. If you want to be very aggressive, otherwise I think it's just once a day would probably also suffice. But if you have time and you're not in a rush, do it twice a day. Same time you brush your teeth. So, okay, so the nasal saline spray is exactly the same thing. It's the same principle as neti pot. Neti pot is kind of more traditional. The saline nasal sprays are a bit more modern. Choose your poison and pun intended, and do it that way. I personally feel like the sprays, the volume of the sprays is going to be less. It's a little bit harder to do. It's also a lot more costly if you're buying something already pre-made, because again, this is long-term, right? So you want to maintain and do it regularly. And of course, neti pot, if you have a filtered water, it's going to cost a lot less, and a little bit of salt is close to nothing. My preference. Good question, though. Okay, so then there's another. Linda's asking another question, which somehow I missed. Sorry about that. Is the reversing of brain effect cognitive impairment likely through the brain neural work around or actual restoring the pre-brain trauma COVID? Yeah, no, I don't think that the brain, if the particular connections are lost, if the specific trauma caused disruption in some neural pathways, it is, you're regrowing them. So you create new pathways, and then you have to re-educate the pathways. So that's perfect segue to the last five minutes maybe or so, talking about stimuli. That's the whole value of doing the things that I'm going to list. So exercise, definitely supportive for the brain regeneration. The breathing practices seems to be doing that too. The light therapy, so I'm going to put the link. First of all, let me close off the slides. You're not seeing them, but they're blocking my screen. So I'm going to close them. Okay, now I'm going to get you to the. All right, where is my? Okay, I'm just going to type this ALZ because I don't know why I can't find my windows. Okay, so if you go to this website, alz.life, so this is a free system that you can use on any iPad or iPhone Pro, and also lots of different Android platforms. It delivers both light and sound therapy. They're 40 hertz. I have done a video about this on my YouTube channel. Again, I will give links to Janet. For some reason,
I can't pull out internet windows, and I don't want to spend time figuring out why, because we still need to get to the practice.
Okay.
But what I'll do is I'll give the links to the videos in, so that if you want to revisit this, you can. But you can also just go to alz.life. You will need an approved device for this therapy, but it costs you nothing. So the app itself is free. There are lots of different light and laser devices to stimulate the brain. There are a few that FDA approved. Those are either you can't really get them outside of research, or they're just exuberantly expensive. There's one system called V-Light. I don't necessarily recommend it just because of the cost, but it's a combination of 40 hertz with a red light. And you have a system that can be looking like a helmet, or something that literally goes up your nose. And so that red light is shined all the way in the back of the nose, which makes it very close to the brain. They have a data supporting the benefit of that. So that's V-Light. And again, unfortunately, I can't even check the spelling because I can't get on. Oh, there we go. I don't know. Just give it 1 second. I'll put that link. All right. So I'm putting the link into the. And they have a systems ranging. The V-Light is ranging anywhere from like $1,500 all the way close to $10,000. So it's a very expensive technology. I expect that this is all going to gradually become cheaper over time, but this is one system that's been advocated for the use of combination of different lights. So definitely neurostimulation, definitely allowing your eyes to naturally relax and take in 3D. Very, very important aspect. Remember, we've had a lot of nature walks and forest bathing. One of the key aspects there is that our eyes are traditionally supposed to take in 3D surrounding. When we shift to 2D, it's a stressor on our system. So right now I'm talking to you and I'm looking at the screen. My system is going to be stressed just because it's supposed to continuously concentrate on something that's not natural for us, right? So that's part of the reason why it's so essential to be outside, to intake 3D and not continuously stay in the presence of the screen. It's actually clearly there is a data to say that the forest bathing or just being outside and taking in far scenery with the eyes in 3D is helping the brain cells to regrow, if there's data. Same goes with the correct sleep and a generally normal circadian rhythm. Essential that you do that, because otherwise the neuronal regeneration is slower. Cognitive gaming. I'm very eclectic here. Those of you who know me probably heard multiple times that I would say, sure, there is more evidence for things like Brain HQ and luminosity just because they've actually run controlled trials showing benefits. But in my opinion, you don't have to do that. Learning any new challenging brain tasks is just as good of a strategy, but it has to be continuous, it has to be persistent, and it has to get you from in a progressive way. So it's not enough to learn a particular skill at which you got really good at, and then there's a flat line. So then you're not getting any further, you just keep repeating the same thing. That doesn't seem to be effective for regrowing the cells. What seems to be effective is that when there is a continuous component. So like I don't know, I'm seeing a B right in front of me, B. Lipson, who's been teaching Tai Chi forever. So B knows that there is literally hundreds, if not thousands of Tai Chi forms. So once you finish one, you can go and learn a new one. And that push to learn the new technique, especially the technique of moving of your body, in my opinion, that's a stronger memory stimuli than just simply doing a computer gaming. Now, I can't unfortunately prove that with the science. I've never seen the study done comparing cognitive training using a computer versus, say, Tai Chi. I think that would be difficult to establish a study like this. And so what you would do is you would pick that new task or new body task and continue progress with it.
So because of that, yoga would be almost as good, although in yoga, people generally often follow the teacher and they're not memorizing the pathway and then path of sequences of asanas and then going home to do it. With Tai Chi, you do a lot of it. You would often come to a class, you learn a piece of form, you go home to practice, and then you gradually make the full form. And then you practice it for a while. If that's your path, love it, do it. Don't stop learning new forms. Don't sort of say, I'm going to learn 20, young 24, and that's all I'm going to do. No, you have to keep on learning new things continuously. If you're doing it for brain, you're doing it for general fitness, for exercise, biomechanics. The third is my favorite one is a dancing, particularly, again, some kind of a dancing where you have to continuously learning things, right? So that could be Latin dancing, could be ballroom, could be anything where you continuously learning new steps, you continuously learning new moves, particularly, I would say, if those movements are constantly complex. So there could be very simple movement, back, forth, left, right, or you could have movements that engage body to shift positions in such a way that it's much more sophisticated. Turns, different leads, different transitions, all of those things are going to be more challenging for your brain to memorize compared to just a simple step. So those are my top things. And then, of course, learning a new language would be or learning a new game, like a new table game, new computer game, new any game, and especially the games that are complex, like strategic games. Well, I think it's time for us. I'm going to take a look at the screen, make sure I didn't miss any questions, and then we'll go to Janet. I think I did answer.
I have one, Misha, from if your eyeglasses have blue light blocking, will you still benefit from light therapy you're suggesting?
I don't know. I don't know. I would presume that you shouldn't do that because I think I don't know how to answer that, but I will find out. I would say don't use them because they're probably blocking some aspect of certain wavelengths. I would say for the 40 hertz, it probably doesn't matter because the 40 hertz is a blinking light. I don't think that the blue light eyeglasses remove the blinking, but they probably remove some spectra. And that certain spectra of the light with the red light particularly is beneficial. I haven't researched this enough for today in preparation to tell you exactly about red light, and I don't think it's essential, but yeah. Okay, Neti pods are good, but I like to. Yeah, so Nail Med has been kind of very popular. It's the system where it's a kind of a proprietary blend with it's kind of a scored bottle. I think they're different models. They're very useful, very simple. They're not expensive. So use whatever you prefer. I don't think it really, frankly, matters. It's the same principle. You want to be
the same thing. The only thing for me is it's easier for me to use the bottle than the pot.
Mm-hmm.
That's it, but it's the same thing.
Right, and then we talked a little bit about if you're not afraid of staining periodically clothes or your skin with certain colors, I love using this substance, Propolis, which is usually you buy it from a decent supplement dispenser and you want to get liquid form as a Propolis tincture. And you would put 2-3 drops into Neti pot. By Neti pot, I mean whatever the solution you're using, whether it's Nail Med or just a saline wash. So the Propolis is antibacterial, and in a low dose it still works, and it's quite safe, and there's no known resistance because it's a very complex product. Okay, so let's kind of finish up with being here, and then let's drop to being below. Come into the bodies and do a little bit of a practice, just like we always do. So, and you can do this laying down if you prefer. You can turn off your screen if you want. You can do it in any form. So we're gonna do a practice that we've done. It's called sorry, I think okay. It's called a heart-centered breathing, and we're going to switch it to something called quick coherence practices borrowed from HeartMath. HeartMath is a biofeedback system that we've been using at the center for a long time, but also it's a very, very effective system. We actually did a podcast. Janet and I did a podcast about HeartMath with their research director quite a long time ago. You can check that out if you want. So probably best to close your eyes for this. If you're laying down and if you know you have a tendency to falling asleep, keep your eyes open. If you're sitting up or you're comfortable keeping your eyes closed and not drifting away, then you can close them. Closing of the eyes helps to concentrate on the practice, but it can also shift you a bit too much into too deep of a relaxed state, and then you may fall asleep. So begin to attuning your concentration to the area around the heart. I always think of it as if you can try to tune into the heartbeat itself and feel where it's originated, you'll find it originates from the heart, of course. It may be helpful just to put the right hand over the heart. See if you can pick up a pulse on the skin. We do need to tune into sensing the pulse because part of today's practice, we'll see if we can connect the breath and the heartbeat. But for now, you can just tune into the left of the chest. And begin to slow your breath down a little bit. Make the breath steady, deep, not forced. So you're doing inhalations that are deeper than your usual average ones, but you're not forcing the air all the way in. You force it, you kind of move it about 2/3, so there's still a big reserve left. And then when you exhale, you just relax, let the air out. And we're doing all of this while we're keeping a concentration on the left side of our chest, on the area of the physical heart. And as you're tuning into the breath, as you're controlling the breath, as you're slowing it down, as you keeping your awareness to your heart, you may start picking up heartbeat better. And if you don't, that's fine. Don't worry about it. We'll get there. Okay, so now that we are comfortable with this pace, we picked our own rhythm of breathing. We're aware of our hearts or our physical heart. Now we're adding this sensation of inhaling and exhaling through the heart. It may be helpful to literally think through when you inhale. You bring the air from outside, but you also can imagine bringing energy through your heart into your body. Then when you exhale, you reverse. So you let collected energy be expressed through the heart out, opening the heart, tuning it into the surroundings, while you're maintaining focus on your breath and on the heart. So let's do this part for a minute or so. So now when you inhale, you bring this positivity and you're going to invoke a feeling. Traditionally, it's thought to be best to think of someone you love, someone you really adore or admire. Maybe it's your pet, maybe it's your spouse, maybe it's your kids. Could be a place you love, a place that in your mind always triggers positivity, always triggers state of awe, and maybe a state of peace and tranquility. So bring that into your field of consciousness. And when you inhale, you're going to literally imagine that this benefit or this sensation, this positive attitude get brought into your heart from outside, into physicality of your body. And then when you exhale, you reverse it. So you let it out, you exchange it back into the environment. And you continue this. And we're going to do this for, let's do it for about 3 or 4 minutes without any additional instructions for now. Okay, so this was probably about 3 minutes. So now, hopefully you're found a pretty balanced state. Maybe let's tune into our hearts, tune our bodies. Just check in, see how you feel. See if you notice your breathing steady and your heart rate is a little slower, maybe. Maybe you just feel a bit more positive. So now if you're not identifying yourself easily with a pulse and you can't pick up and sense the beat of your heart, find the pulse on your body physically. So you can obviously find it right here, just on the wrist. You can also try to put your hand like this over the neck and see if you can pick that up this way. Or again, you can just put it over the heart. Some people, it would be easiest for them to do it that way. So I'll give you a second to pick the right way of measuring your pulse. And we're adding this last component to this practice. So we first centered in the heart, we deepened our breath, then we brought a state of positive awareness, state of love, state of compassion, state of awe, peace into our hearts. And now we're going to sync our breath with our heartbeat. So we're going to start by inhaling for the count of 3 heartbeats and then exhaling for a count of 3 beats for a minute or so. And then we're going to gradually begin to slow it down. So starting with the 3 beats. So that's going to be for some of you quite fast. If you feel it that way, feel free to just begin quickly to slow it down. So maybe 4 beats on inhale, 4 beats on exhale, and then keep going up. Go up to 5, to 6, to 7, to 8, When you get to 8, you're going to potentially, some of you may start struggling with the breath because it will be a little too slow. If that's the case, you can drop down, or you can just continue to relax and see if you can achieve your particular number that you put your mind on. And whatever your personal length of the heartbeats is, let's do it for 2 minutes, 2 or 3 minutes. And you may need to go up even more. You may need to go up to 10 or even to 12. Whatever your personal pace is, just stay with it. So you're staying with the pace. Make sure you maintain the awareness in the area around the heart and awareness on positive emotion. Bringing that positivity in on exhale and then letting it go. Returning it back into the rest of the system. Stay with this pace for another minute or so. This last part, we will start gradually coming back. So you may want to lose some concentration on the count. Let go of attaching the breath to the heartbeat and just staying aware. Stay aware put your awareness into how you feel, how your mind feels, how your emotions feel. Tune into, just feel if there's anything your body is asking for to be released, or any emotional state you want to particularly pay attention to. Maybe you had some thoughts that drew your attention. Maybe there was some anxiety that came during the practice. Just take a stock of them. Keep attention. Not that you need to have answers for anything, but it's good to have a awareness that certain things have come. Apologies if you hear some background noise, but do take another minute of whatever it is that you need to do to finish the practice. And begin to slowly come back. Open your eyes. If you were laying down, don't get up quickly. Just kind of wiggle your fingers and toes and roll to your side and slowly sit up. And to close, let's do a little bit of a kind of waking up our face and relaxing our eyes. So just brush your hands like this for 30 seconds. Wait until hands get warm and then put them over the face and then gently massage. It always helps me when I'm concentrating a lot on the screen or when I'm feeling tired. This is a very good practice to drop some of the tension. Okay, friends. I'm not going to see you next week. I believe we're still figuring out who's going to be here. I'm taking a little